Welcome back. Time is 7:42. The Centers for Disease Control and Prevention, or CDC, has recently added new conditions for its childhood vaccine recommendations. Children and their caregivers will be able to get COVID vaccines in consultation with a doctor or provider, which the agency calls shared decision making.
And this comes just days after Health Secretary Robert F. Kennedy Jr. announced that COVID shots would be removed from the federal immunization schedule for children.
So we're going to go ahead and bring in, the pediatric physician and CEO of PenPal and Parent Partners, Dr. Alana Arnold, to talk about all of these changes. And Dr. Arnold, what are you hearing in terms of confusion about what parents should do with this?
Yes, good morning. Thank you for having me. So it has been a bit confusing in terms of recommendations that have been released recently. Typically, you should always be speaking with your pediatrician, your caregiver, about what is the standard of care and how you should proceed with a vaccination schedule for your child. So it's really important to connect with your pediatrician to make sure that you understand the changes that have been going on and what's best for your specific child, because sometimes it's not always just one size fits all.
Dr. Arnold, as a parent, my girls are older. They're not in this most of this category range here, but still, as a parent, I'm struggling with. I feel like every family has their own set of truths or facts. If you listen to the health secretary, you hear that there are risks that come with vaccines, and then you hear from the CDC. Or where do you turn to know what's best for you and your family? Because one day you hear one thing, the next day it changes.
Yeah, you bring up a good point, and I always say that, the vaccine schedule that we have, you think about MMR, right, measles, mumps, rubella, all of those things have been around for decades. They have been vetted through robust studies in terms of evidence-based medicine to make sure that, on the whole, they are extremely safe. We've had them around for decades. And so it's critical to understand that, there's two avenues for vaccination. Thankfully, most children are generally healthy. But the real reason why we endorse vaccination overall is that it creates that public health shield, that herd immunity to try to prevent outbreaks of preventable diseases. Thankfully, I'm speaking as myself as a millennial, most people have not had to live through these horrible outbreaks that maybe our parents and grandparents have had to live through. And so it's really important for the public to understand that the goal for vaccination is to protect your community, as well as individuals that have a higher risk of having complications, so chronic illnesses or the elderly. So having that lens, I think, helps people to understand why it's so important to get vaccinations that have been proven to be safe over decades and decades.
Dr. Arnold, one of the things that we've also seen coming down is potential cuts to federal public health funding, which could mean loss of positions in rural areas. With PenPal, you work with some of these rural areas, providing guidance to them. Losing one or two positions in a rural area, what does that do in terms of the health care that's able to be provided?
It's devastating. Over the past several years, and the pandemic really highlighted this, that there are shortages in the healthcare community, and it makes it much more challenging to deliver services. So these cuts can be quite, have huge ramifications for the communities in terms of access to healthcare, as well as vaccination schedules. A lot of these facilities, you think about schools, for example, the school nurses are the ones administering the healthcare there, or just in community settings giving vaccines, and cutting those services can be very, very challenging to get access to those communities for things that they need. And so it is, concerning that these cuts may play out, because it's going to be the communities and those individuals, those families that are suffering, who aren't getting the access that they need to the proper health care.
And Dr. Arnold, talking about access here and focusing specifically on the COVID-19 vaccination and the changes that are coming, will this still be accessible to parents that say, hey, I really am interested in having this for my child? Or do they need to be aware that they may not have the same access that they previously did from the federal government?
Yes, that's a really important point. So hopefully there's going to be some type of re-equilibration in terms of what's going to be covered by insurance or what you would need to pay out of pocket. The access issue does come into play because obviously there's a large population of underinsured and uninsured in the country. And so making sure that they have access to vaccines when they are asking for it is going to be critically important. So I think understanding what your options are in terms of a vaccination, speaking with your healthcare provider, knowing what your insurance covers, and then specific programming sometimes that will offer lower cost vaccines or free vaccines is going to be really, really important, especially as we go through the summer and into the school year when kids are getting their annual physicals and getting prepared to return back to school later on.
Dr. Alana Arnold, thank you so much for not only what you're doing to try to help keep kids and families safe, but rural communities trying to help with, trying to keep their communities healthy as well. Thanks for your time this morning. We appreciate it.
Thank you so much for having me. Have a good day.
You too.
Queen City News Plus. Just search Queen City News on your smart TV's app store.